Good morning, everybody. I'm really excited to welcome you here this morning. I'm Pauline Mendola. I'm professor and chair in the Department of Epidemiology and Environmental Health here in the School of Public Health and Health Professions. I want to start out this morning with a land acknowledgement statement. We'd like to begin by acknowledging the land on which the University at Buffalo operates, which is the territory of the Seneca Nation, a member of the Haudenosaunee Six Nations Confederacy. This territory is covered by the Dish with One Spoon Treaty of Peace and Friendship, a pledge to peaceably share and care for the resources around the Great Lakes. It's also covered by the 1794 Treaty of Canandaigua between the United States government and the Six Nations Confederacy, which further affirmed Haudenosaunee land rights and sovereignty in the state of New York. Today, this region is still the home to the Haudenosaunee people, and we are grateful for the opportunity to live, work, and share ideas in this territory. So with that, I want to welcome you to the 16th annual Saxon Graham Lecture. Thank you. So this lecture and award ceremony commemorates Dr. Saxon Graham and his contributions to the department and to the field of epidemiology more generally. Dr. Saxon Graham was a longtime UB professor and chair of our department from 1981 to 1991. He was an internationally recognized cancer epidemiologist, most well known for his groundbreaking studies on diet and cancer, which started in the 1950s when the prevailing wisdom was that it wasn't possible to study diet using epidemiology. At that time, most such work was done in animal models. We know that it's quite a good thing to study people, so good for him. The impact of Dr. Graham's example of research excellence persists in his continuing example to all of us and in this annual lecture. When putting the plan for this lectureship together, Saxon considered the impact that he had on the students and other mentees that he worked with to be one of the most important parts of his legacy. In recognition of that legacy, we have 2 graduate student awards that have been funded by generous gifts in his name from alumni, faculty, and friends. I'll give you a little background on those awards and then invite Dr. Lena Mu to introduce this year's winners and talk a bit about their work. First, our highest distinction is the Saxon Graham Dissertation Award for overall academic excellence. This award goes to a recent graduate of the epidemiology PhD program. It's a recognition of the excellence in all aspects of the program completed by the student, including the quality of the research. The student must also have had an active engagement in data collection. Second is the Saxon Graham Research Award. The Saxon Graham Research Award is a wonderful resource in that it provides funds for doctoral students to support their dissertation efforts. This award was initiated by Dr. Graham, his son, Saxon Graham Jr., and Dr. Jim Marshall. And now I'd like to turn this over to Dr. Lena Mu, our Education Committee Chair, who will announce this year's winners.
Thank you. Good morning, everyone, and welcome you all. So first, I want to thank 2 award review committees for your excellent work. Thank you so much. When I announce the award winners, please come up and receive your certificates. It's my honor to announce the winner of this year's Saxon Graham Dissertation Award for the overall academic excellence. The award goes to Dr. Lindsay Matic. Congratulations. Lindsay joined our program in 2018, and her dissertation focused on follicle stimulating hormone and bone loss in postmenopausal women. Her dissertation committee included Dr. August Balcom, Dr. Jean Watatsky-Wendy, and Dr. Lily Tian. Lindsay was a highly productive with regards to obtaining grant funding and publishing papers. She received a very competitive NIH F32 pre-doctoral fellowship to support her dissertation work. And she was also awarded a WHI Junior Investigator Award and the SUNY Graduate Research Empowering Accelerating Talent Award, and also the UB President Fellowship. During her time in the program, she published the 5 first author manuscript. Thanks Dr. August Balcom for her excellent leadership in mentoring. Lindsay was also very actively engaged in academic service during her time at the EEH. She held the leadership role in EEH GSA Graduate Student Association as a president and also the vice president. She was involved in primary data collection, including laboratory pool from the biobank and participation in the breast density microbiome study. Lindsay has an outstanding record of research and academic accomplishment, as well as academic service to the department. We are extremely proud of Lindsay and her accomplishment. Congratulations. Congratulations. Just want to say, yeah. Thank you. Lindsay, like to see a few words?
Sure. Now they told me I was going to have to say a few words. I just wanted to thank everyone on the Saxon Graham Dissertation Award Committee for considering my application, and Dr. Oaks Balcom for her incredible mentorship and sticking through me over these past 4 years. And I wouldn't have the position I have now and be where I'm at in my career if it wasn't for the mentorship and guidance I received here at EH, not only from my dissertation committee, who are amazing, but also all of the faculty members who contributed to my education here. And I'm so appreciative of my time here at UB. And I never got to meet the late, great Saxon Graham myself, but I was directly mentored by his mentees here at the department. And it was really great to feel like I got to experience some of his legacy through those people, and they contributed a lot to my success. And I'm really appreciative of that. So thank you.
Thank you, Lindsay. Congratulations again. Next, it's my pleasure to recognize this year's recipient of the Saxon Graham Research Award, John Louis Atter and Ahmad Solomon. You please come up. Congratulations. John is an outstanding PhD candidate, and he's working with Dr. Kirsten Moisich, Joe Friedenheim, Kula Odyssey, and Brian Siegel on his PhD dissertation. For the awarded research project, he proposed to leverage the hormone and ovarian cancer prediction study to determine whether X chromosome inactivation measured in the post-treatment peripheral blood is a reliable surrogate marker for pre-treatment XCI in the tissue from which ovarian cancer arise. John was a student leader in the American College of the Physician. He received many awards, including Grindley McKim Smith Women's Health Fellowship Award from the Foundation of Women's Wellness. Congratulations, John. Our second winner is Ahmad Solomon, the PharmD who joined us, our PhD program in 2021. Ahmad completed his first year coursework remotely in Egypt during the COVID pandemic restriction and got a very excellent record on the coursework. His background as a critical care pharmacist in the hospital setting helped to focus his dissertation work on using the pharmacoepidemiology approach to investigate the proton pump inhibitor PPI use and the incidental primary clinical CVD event in postmenopausal women. His dissertation committee include Dr. Mike Lamont, Dr. Amy Millen, and Dr. Jean Wataski-Wendy. Ahmad also received a pre-doctoral fellowship from American Heart Association to support his dissertation work. Dr. Lamont also very proud of his recent excellent presentation at the 2023 American Heart Association's Epidemiology Council meeting. For this particular awarded research project, he proposed to conduct a biomarker analysis from the stored serum sample and explore the cross-sectional relationship between the PPIUs and the fibrinogen in the Peril study. We're very proud of both of you and your accomplishment. We certainly expect to hear more about your continued success as you move on in the program and in your career. Congratulations.
I was like, your poor face will be in the light. Oh, that's great. Thank you. Thanks, you guys. And now we'll move on to the Saxon Graham lecture, and we have a special guest today to introduce our keynote speaker. Let me welcome Dr. Andrew Hyland to the podium. So I've known Andy for quite a while. He and I crossed paths as graduate students in what's now EEH, and it's a pleasure to introduce him today. Andy's the chair of the Department of Health Behavior at Roswell Park Comprehensive Cancer Center. He's very familiar with UB, with all three of his degrees coming from the university. That's the same for me, including a PhD in epidemiology and community health. Andy's been continuously funded for nearly 30 years, and he really has too many high-impact papers that shape tobacco policy to count. He's internationally recognized for his work, and especially relevant to today is that Andy was the major advisor for both of Dr. King's degrees here, the MPH and the PhD that he got here at UAB. So welcome, Andy.
Thanks, Pauline. Yeah, I do have a few degrees. Right from here, I couldn't get enough of this place. I'm born and bred from Buffalo. I went to Kenmore West and studied math over in Diefendorf back when the math program was there in the stats. In Porter Hall, that's how important statistics was back then. It was in Porter Hall. Then it moved over to Farber. And on my way to class one day, I think I got lost. There's this like library on the second floor at Farber Hall. And I wandered in that and found an article about skin cancer and sun exposure in Australian men. And I'm like, that's it. That's how I can use math and statistics to help improve the human condition. And that's what sort of motivated me to just walk a little bit further on the other side of the hall from the stat program into the 270 Farber suite and into SPM. I had the opportunity to briefly intersect with Saxon and learn and inspire by him and by Joe and by Gene, especially some of those Niagara County, battles over the smoke-free issue were super important along the way. As Pauline mentioned, I've had the good fortune to work with Brian while he was toiling through his degree requirements. We shared some public testimony road trips together, visited some Irish pubs, and spent some time at a remote mountain retreat where the only entertainment was the wine. And Brian is actually a fantastic piano player, and that sort of livened things up a little bit. Brian started working at the New York Quit Line when he first came in there as a tobacco treatment specialist. People all over the state call us looking for help quitting smoking. Most are uninsured. They have fewer years of formal education. They're racial ethnic minorities. they have mental and physical health comorbidities, and they have a lot of pack years under their belt. There's no better place to get a sense of the human condition than working with people such as this looking for help each and every day. His doctoral degree, looking at issues related to secondhand smoke exposure in multi-unit apartment buildings. There's about 80 million people that live in multi-unit, think New York City, kind of high-rise sort of thing. So it's a big deal, 80 million people. This is a wonderful, fantastic example of using scientific data to try to protect vulnerable populations. And there's no better example than kids living in an apartment building, being exposed to toxins, floating up from a downstairs unit, someone smoking cigarettes. So that opportunity. These data became instrumental, and I'll point out these data are still the standard for this area of literature, the work that Brian had done. These data were instrumental in the federal housing and urban development, providing a nationwide policy for all of their properties that smoke-free was going to be the norm for all of the residents that they provide housing for. Brian and I would meet weekly at a little table in my office, and when the light at the end of the tunnel of the degree became, okay, what's next? What are some of the next steps? I'm like, okay, what do you plan? So I go through the options, academia and all sorts of things. And Brian's like, public service. I want to do public. I'm like, are you sure? Are you sure? The pay is like kind of stinks, and everybody's gonna blame you. Like, trust me, I'm from the government. It's just not something, but. Absolutely, public service, CDC. I want to do CDC, and the EIS program is right. Are there any EIS alumni here? And there, EIS is a fantastic program, and so out of that conversation with that public service through the EIS program. Now here, most of this is real doctors, MD doctors doing looking at real epidemics across the world, not this tobacco stuff. That's kind of a fake epidemic, my words, not others. But there are a few PhD slots. And once in a while, the tobacco group would get a person or two. So Brian set out to prepare himself to get into the EIS program. Super competitive, Ivy League types, all over the world kind of competition, and he did it. He got in, and he quickly set himself apart from others. And soon after, he took a position as full-time in the Office of Smoking and Health at CDC, and he rose through the ranks there and really created that office into, I would describe, a scientific nirvana. Where there were scores of papers that were published from these amazing national surveillance systems, amazing data sources that were previously being, collecting dust, and really helped transform that office into one that's science-driven and using that to set the stage to inform program and policy action at the national level. That set Brian up for some reason to take this new position as the center director for the Center for Tobacco Products within the FDA. This position, in my opinion, is the most influential tobacco position in the world. He's setting the agenda for what federal tobacco policy should look like. Tobacco still is the #1 leading preventable cause of death, 480,000 deaths a year. And others, believe it or not, do look to the United States to lead here. But he's doing this, he's setting that agenda, but he's doing it in a way that is, one, grounded in the science, but balances the needs of all stakeholders and does so within the confines of what's allowable under the law. So it's a hard job, a really hard job, probably an impossible job, because there are factors that are beyond his control that can serve to undermine things, but it's an amazingly influential position. We're all lucky that Brian's doing this work. And I'm confident when Brian comes here and you hear his message that you'll recognize he's up to the task. So, and all of these things is well before Brian's first colonoscopy. So he is the, I think, I don't know, I'm just guessing based on the guidelines there. And his talks are always worth the price of admission. Rumor has it these tickets were on StubHub going for outrageous sums of money, well into the many cents range. And so it's a great honor for me to introduce Brian for the 16th annual Saxon Graham Lecture, a great scientist, a master communicator, and a voice for the underserved. So let's welcome Brian back to Buffalo.
Thanks, Andy. Appreciate it. Great, great. Okay, can you hear me in the back in the cheap seats? Wonderful. Thank you, Andy, for that marvelous introduction. It's all true, all of it. I owe my career to Andy. He taught me everything I know. And he's one of the great mentors that really supported and everything. And, you know, you sometimes have those folks that aren't fully supportive and don't like to see you succeed. And for me, he was right there with the lighter fluid and the fan, like go as hard as you can and pursue your dreams. And that was just a marvelous thing and time. So sincere privilege to be back here. I'm a proud recipient of the Saxon Graham Dissertation Award and also had the privilege of meeting Dr. Graham on many occasions prior to my graduation from this program. So it's a sincere honor to be back and to see so many recognizable faces and to meet new folks. It's just such a treat. I will say that one thing I'm not thrilled about being back is that now that I'm back on the speaker circuit after the pandemic, I'm having to wear non-elastic pants. It's highly problematic. I suffer from a syndrome that I call the COVID-15. And the COVID-15 is the phenomenon when you sit around for 2 years watching Netflix and eating Chunky Monkey Ben & Jerry's ice cream for prolonged periods, you put on some poundage. So I'm currently dealing with that. So if I keel over during the middle of this, it is not problematic. It is lack of oxygen flow to my lower extremities. So with that, we're going to get started. I'm going to talk for the next hour or so. And I thought that I'd jazz up the title a little bit. And it looks like it works. We're like standing room only into the back. A hot ticket today. And I'm going to talk you through the Hitchhiker's Guide to Tobacco Product Regulation, which is what I do. As Andy said, I lead the tobacco regulatory efforts for the U.S. And as part of that, there's a lot of promise and there's a lot of peril. And it's definitely a tough way to navigate through the system, but I'm going to try to distill it down. I can tell you that there's a lot of drama with everything that happens. It's worthy of at least one Lifetime original, maybe a telenovela at some point. But I'm going to try to distill it down, and then we're going to open it up for Q&A. So hopefully you can save your questions for then. And I also welcome some input as well from folks. I know we have several people on the line remotely, so we'll have some good dialogue at that point. So without further ado, we're going to get started. So I've developed a roadmap here of where I'm going to take you the next 45 or so. And we've postulated this around a hitchhiker in terms of the different categories of tobacco regulation and the nuances around what we do, and what our ultimate public health goal is. And that's really critical. My key job is to make sure we take the science and we translate it into practice in a way that is actually going to help people. Easier said than done, particularly given some complexities that I'm going to walk you through. But I'm hopeful that by the end of today, you'll really have an appreciation for what are those tools that you need, that you make sure you have you're in your bag before you hit the road. What's the destination? What's the direction? Where do you want to go in terms of your ongoing work? What's the map that we use in terms of making sure that we're getting to that pathway in a meaningful and science-based ways? Knowing where you are, continually checking about where are we and where do we need to go? How far along are we towards making those goals? Making an effective sign and making a lot of noise. And that's particularly important and something that I learned right here at UB and at Roswell Park Cancer Institute. I still remember the first time I was tasked with doing media. It was by Dr. Mike Cummings that many of you know. And I remember him walking into my office and he said, "You're going to do the media for this event." And I was like, okay. And it was the 5th anniversary of the 2003 New York State smoke-free indoor air law. And so I remember going there, it was at the Anchor Bar in that entry room. They had all the media and they had the microphone and I was there. I'm sure there's a picture somewhere. I probably looked like an absolute fetus in the photo. I was very young and I get up to the podium and I do my spiel and then they open it up to questions. And Mike Cummings asked the first question in front of all the media and it was a tough one. But that was like, you know, just get prepared. And so definitely a good learning experience and reinforced the importance to me that it's not just having the science, but it's making sure that you communicate in a way that people are going to understand and it's going to have an impact. You also have to be mindful of the weather. I got some stories. I got stories for days. I've been in the federal government 13 years. and I've had a lot of experience. I was the chief science officer for CDC's COVID response in between the gigs in tobacco at CDC and here. And so there will be a book one day, but not in the imminent future. But you have to be mindful of those landmines and being able to work regardless of those factors. And I'm proud that I've worked across multiple administrations, and that's a good thing and what civil servants should do to make sure that you're very clear about what the mission is and that you continue to do that and let the science drive your work. And then finally, stay safe. There's some nuances that I'll talk you through in terms of making sure that you've got the evidence on your side and that you use that in a really meaningful way. So with that, let's pack our bags and get ready to what the tools we need for tobacco product regulation in the United States. You'll notice my style is very non-bureaucratic. I pride myself on being the most non-bureaucratic bureaucrat in Washington. So my slides are very TED talky. So there's not going to be a lot of text, a lot of visuals, and just follow me as we walk through. So in terms of tobacco regulation in this country, we've had a lot of progress over many decades. Some of that was all the way back into the 1960s, where in 65, we saw the Cigarette Labeling Act, where we put the warnings on cigarette packs that you still see today in terms of the Surgeon General's warnings. And then in the 70s, President Nixon signed legislation that prevented advertising for cigarettes in certain places, like on television. And so we saw a lot of progress over time, but it was very incremental. And there was really a need for a broader clearinghouse of tobacco regulation in the United States. And so at that time, in the late 80s and heading into the 90s, there was really a desire for a single entity to regulate. And so the Food and Drug Administration tried at that time. And the intent with David Kessler, who was the commissioner at that time, was to regulate these products as medical devices. And so they attempted to do so, and then they got sued. And that's the story of my life. Another day, another lawsuit. And it still continues. And at that time, there was concerns, particularly by the industry and the a plaintiff in this case with Brown and Williamson, which was a tobacco industry that sued the FDA in terms of saying that you are not legally able to regulate the products in this manner. And so then things kind of simmered and they went all the way up at some point, all the way to the Supreme Court, and the US government lost. And that happens on occasion. And so then we had to go back to the drawing board. And the main argument was Congress has to give you the authority to regulate, and you can't decide on your own that you're going to regulate those products. And so that ultimately led to the 2009 Tobacco Control Act, which you may have heard as the Family Smoking Prevention and Tobacco Control Act. And this was signed by President Obama. And it was the result of many years of effort to give FDA the authority to regulate these products. It obviously went through Congress since it was an act. And as part of that, they carved out what is the Center for Tobacco Products. And so that's the center that I lead. And we were given the authority to regulate the manufacturing, the marketing, and the sale of tobacco products. And so that's our trifecta and what I have authority over. There's certain things we can't do. And so smoke-free laws is a good example. We don't have authority to prohibit the use of products in public places. That's something that sits at the primarily state and local level. Things like taxation aren't under our authority, but the manufacturing, the marketing, and the sales of those products are what's in my jurisdiction. And so we've had some evolution since the Tobacco Control Act. So originally, when the act was written in 2009, it gave us the authority to regulate products containing nicotine that were made or derived from the tobacco plant. And so that's very nuanced, and most nicotine that you see in products comes from the tobacco plant. And so there's been pronounced production over that for many years, particularly in what I call the tobacco belt of the United States. And so most nicotine, if you were getting it was coming from the tobacco plant. And as also the initial Tobacco Control Act also gave us authority for only certain products. And so it was cigarettes, it was smokeless, a lot of the conventional products. And so in 2016, what we did was a maneuver that was part of the act to deem other products, to bring them under our authority. And so we brought e-cigarettes as well as several other products to make sure that we were really nimble and able to regulate the full diversity of products that are out there, right? Because from public health, you got to have to keep a wide scope to make sure you're addressing the products people are using. But then as time went on, we realized that there was a loophole. And the loophole, again, was that made or derived from the tobacco plant. And so what did industry do? They tried to find a way to circumvent it, and they started creating nicotine in labs, synthetic nicotine. And so it was no longer derived from the plant. And so it was a flagrant loophole that people could use to get around regulatory authority. And so the cost of synthetic products in the lab kept coming down, down, down. And it was finally low enough to a level where people could make it and actually get a profit. And so that quickly got put on the radar of FDA and the public health community is we got to close this. And so in April of last year, in 2022, US Congress passed a bipartisan bill and it became an act in law, and it was clarifying our authority to regulate all tobacco products containing nicotine, regardless of the source. And so a very important close to that loophole, but a good example of how you have to continue to make sure that the tools in your bag are fully equipped to get you on the journey, and you got to be nimble. And particularly when public health, it's very easy to just rest on your laurels and say, yeah, we got everything we need. But that's just not the case of reality. And you have to be nimble and also proactive in terms of ensuring you address these things. So I'll talk a little bit more about the nuances that happened once we got these authorities. Again, probably for the book one day, but I'll give you enough that will be a little bit of flavor. So now you got your bag packed. Now you have to have a destination in mind in terms of setting your direction. And so this comes back to the Tobacco Control Act in terms of what we are tasked with doing. And so when it comes to tobacco control, we broach it from a wide lens. We want to hit all the angles that are ultimately influencing the adverse health effect. And so that's tobacco-related disease and death. So we do that through three major areas. The first is reducing the number of people who start using the tobacco products. Prevention is key, right? Didn't Benjamin Franklin say that, centuries ago? An ounce of prevention is worth a pound of cure. Still holds, still right. And particularly for tobacco prevention, it's incredibly more effective to prevent it from happening as opposed to having to clean it up on the back end in terms of treatment. And so many of our levers from tobacco control are prevention at that population-based lens. But it's also important that we promote cessation as well and encouraging people to stop who are currently using the products. And so that's the off-ramp. Make sure you get people off of the products once they're using. Remember, nicotine is incredibly addictive. If you look at many of the early animal models of where, the rats would go, the nicotine was right up there with other things like heroin and cocaine in terms of addictiveness. And nicotine is definitely right up there, a highly addictive substance. And so it's important that we have these evidence-based strategies that help people quit through appropriate channels. And then there's finally a third bucket as well that has emerged in recent years, which really focuses on a harm reduction paradigm. And this is reducing the adverse health impact for those who continue to use the products. And so that if you are not able to completely quit, is there a way that you can reduce the risk to individuals from transitioning along a continuum of risk? And so we know that cigarettes are the most harmful products, 7,000 chemicals, 70 carcinogens. But if someone were to quit completely and transition to another product, there would be a net benefit to that individual in terms of their risk. It doesn't mean there's no risk. There's no safe tobacco product, but there could be a lower risk to the individual. And so these are the primary three areas that our center works in terms of making sure that we're broaching our broader level purview and mission to reduce tobacco-related disease and death. And so how do we accomplish that? Well, the Center for Tobacco Products at FDA is very unique. So most centers at FDA, there's others that regulate food, there's those that regulate devices, and there's a Center for Veterinary Medicine. They have what we call a safe and effective standard. And so Congress gave them a very clear purview in terms of you have to decide whether these products or these devices are safe, they're not going to harm people, and are they effective at actually doing what you want them to do, including medicines, to address whatever health outcome you're attempting to address. With tobacco, that's tough, because you're also dealing with a product that kills 500,000 Americans a year. And so we do not approve anything in our center. We authorize the products. And Congress gave us a very clear blueprint in that Tobacco Control Act around what we can do. And so we have an appropriate for public health standard. It's not as safe and effective. And we are tasked with weighing the risks of the product versus the benefits of the product. And of course, that's about as clear as mud, but that can be very useful in terms of the diversity of products out in the landscape and making sure that you're able to apply that standard. And so in terms of the benefits, we look particularly at adult smokers, and if the benefit of a lower risk alternative could outweigh the known risks of the product, which right now the risks are pretty high for many products related to kids. And so we know that these products are highly addictive. We know that most tobacco product users begin before the age of 18, and 99% begin before young adulthood. And so this is a very critical window in terms of prevention. And so we have to look at that balance of the available science. And every company that wants to submit a new tobacco product for sale in the United States is required to submit an application to us. And I'll talk a little bit about that in a bit, but we have to look at all the science and make this determination around, is it appropriate for the protection of public health, which is definitely a key standard that we use in all the work that we do. Okay, So we then have to use our map to know all the ways that we need to reach our destination. And part of that map in tobacco control is acknowledging where we've been. We've made considerable declines in reducing cigarette smoking in this country. I would argue one of the greatest public health accomplishments of the past century. And this is a bell curve that the epidemiologists in the House will note. You rarely see this. This is a perfect bell curve. And we hope that we can continue it moving forward. But this is where we are in terms of cigarette consumption. And you see that there was an uptick all the way up to the mid 60s. The reason that we saw the increase, part of it was the inclusion of cigarettes in the rations of our troops in World War I and World War II. And then after that, you also saw a delayed curve of use among women in the United States because the men brought it home. And so you saw a delayed uptick in terms of cigarette smoking. And it's very interesting to also see the delayed curve in terms of tobacco-related disease and death, in terms of cancers several decades later. We did start to make progress in the mid 60s, and 1964 was the first Surgeon General's report on smoking that really sounded the alarm, particularly around the link around lung cancer. And after that time, we started to see these population-based interventions being implemented that we know work to effectively prevent use and also promote cessation. Remember the trifecta of levers that we move. And we've seen this done at the local, state, and national level. And that's been a really key lever for us in terms of promoting tobacco control, because we know the comprehensive approach is key, and that frequently strategies for public health galvanize from the bottom up. And we've seen that over taxation, over smoke-free policies. Oh, we saw it in Tobacco 21 with increasing the age of sale to 21. All of those strategies galvanized from the bottom up, and the implementation of those over time has ultimately got to us to where we are. That said, you can see that the FDA regulatory authority was only most recently in this broad continuum. And so we've made great progress, but there's still more work to go. And it's so important to know where we have been to help inform where we need to go. And many times the issues that we're facing in tobacco control are just a different chapter of the same book, particularly as the marketplace continues to evolve. So speaking of which, this is where we're at in terms of adult tobacco use in the United States. A lot of folks think we have solved the cigarette issue in this country. Not the case. We're still at about 12.5% of US adults, still about 30 million American adults who are using these products. We've been seeing a little bit of diversification of the landscape. E-cigarettes are now number 2, about 3.7%. The bulk of these are young adults, and we're starting to see a little bit of an uptick in this measure as the cohort of youth who are using e-cigarettes are aging in to the young adult demographic. So we're starting to see a bit of a kick there. Cigars also are about 3.5%, but don't think just like the Winston Churchill cigars. These are little cigars and cigarillos, smaller products, many times very similar in size and shape to conventional cigarettes that are being sold many times in flavors, which I'll talk a bit about soon. And then smokeless tobacco, which of course is also diversified. Don't think like the baseball player chew. We've now got snus and various other products that are more contained in packages and are also smokeless products, including a variety of different types of gummies and lozenges and sticks and various other products that are continued to emerge on the tobacco product marketplace. And then finally, we have pipes as well at 1.1%. So one key component that's also important to remember is disparities. I've said this publicly many times. I think we have been wholly deficient on the issue of health disparities as a broader public health community for many, many years. It's one of the key priorities of mine as the center director at the Center for Tobacco Products, and really being mindful of not only celebrating the progress of overall declines, but really looking at the differential rates of progress and impact of policies, in particular around disparate populations. And when you look at tobacco use, there's marked disparities in use by race, ethnicity, by education, by annual household income, health insurance coverage, disability status, sexual orientation, and gender identity, factors related to behavioral health outcomes, and also where you live in terms of rural status or urbanicity. And so it's really important that we continue to be mindful of these as we implement policies, and also that we're not leaving people behind or maybe even exacerbating disparities in the work that we do. So I do think we're at the precipice of a really important time on this issue, particularly in tobacco, to put this front and center, as opposed to it being an appendix in the back of the book, and really focusing heavily on how we're going to continue to drive down tobacco-related disease and death, and making sure that our programmatic work really focuses on the diversity of people who are impacted by the issue. So that was adults. Now let's switch to kids, completely the converse. So for adults, cigarettes are the biggest game in town. When it comes to youth, e-cigarettes are number one. And so we've seen a bit of a roller coaster ride that I'll present on the next slide. But right now, e-cigarettes are prominent. About 1 in 10 US youth are using these products. And this is among middle and high school students. So think like 12 to 18 age in the United States. Cigars are second, and the surprising, higher than cigarettes. And that's only recently we've seen this. But again, this is those smaller flavored devices, the little cigars, the cigarillos that they kind of look like a cigarette. They're not those Winston Churchill stogies, but they're those smaller products that come in flavors and are available in single unit sales. We also see smokeless use. Hookah use is about 1%. Nicotine pouches are a new phenomenon that have entered the market recently, are engaging more traction. It's a smokeless product that you don't spit. And so it's contained in a pouch, and then the user spits. They don't have to spit, and they can just remove it out of their mouth after use. Heated tobacco products have also entered the market. These are basically a combination of electronic and combustible. And so it's a small rolled tobacco that's inserted in an electronic device, and the manufacturers have stated that the product heats the tobacco but does not combust. And so the argument is that it's a lower risk alternative. FDA has authorized some of these products. IQOS is probably the most notable, but these are getting further traction as of late. And then finally, pipe tobacco as well. So a lot of different products out there. And it's very mindful when we talk about youth prevention is we don't want to do a game of public health whack-a-mole where we're knocking others down and allowing others to go up. When it comes to kids, the bottom line is they shouldn't be using any products. And so our challenge as researchers, as public health practitioners, is making sure we're nimble and mindful of everything that's out there, but also making sure that we have the data to help inform the work that we're doing. Because remember, what gets measured gets done. And so if you don't have the data to document what's happening, particularly at levels of periodicity that are useful, we can't wait for an annual survey to come out before we act. And so you have to be nimble and look at those rapid response data mechanisms, which we do, whether it be intelligence gathering through social media, through retail sales data, through internet panel surveys, to really keep a pulse on what's happening in the environment across the country. So speaking of the environment, this is the roller coaster ride that is e-cigarette use among kids in the United States. You can see that e-cigarettes have been the most commonly used tobacco product since 2014. We saw a marked uptick and a peak in 2019. And since that time, we have seen an apparent decline. I say apparent, and the epidemiologists in the House will be pleased to see that we did have methods changes. So there's some dotted lines, there's some broken lines. It's not a direct trend. But if you look at the absolute number of kids, we peaked at about 5.3 million youth e-cigarette users in 2019, and we're now down to about half of that, of about 2.5 million. So we're still cautious about the COVID pandemic and the impact that kids not being in school could be. It looks like we're holding after kids have gone back, but the next 2023 data point will be important to document where we are at present. So we're still monitoring this, but hopeful that we'll continue to make progress. There's still ways to go. 2.5 million kids in this country are using e-cigarettes, and the landscape is continuing to evolve. We also see use of multiple other products. And as I noted before, cigars are now surpassing cigarettes, is the most, a second most commonly used product among kids in this country. So that's kind of the map. We know where we've been. We have the information in order to build our strategy. And now we have to know where we are on our journey and what are the interventions that we have to implement to make sure we address it. And so at the Center for Tobacco Products, we have 4 major areas for our Tobacco Product Regulatory Authority and what we can do to broach the issue. And again, these are things that Congress gave to us in terms of strategies. And I'm going to walk through each of these separately. The first is review of tobacco product applications. As I noted, if anyone wants to sell a new tobacco product in this country, you got to submit that application, and then we review it based on the science. But also based on those, we also have enforcement and compliance capabilities as well. I know I got a badge that I can go into places. And then we also issue rules and guidances. And then we also educate the public as well in terms of different strategies, particularly around the risks of tobacco products. So let's get into the applications. So I get a lot of flack. If you go on social media, you do Google me, it's not going to be kind. I'll say that. And one of the main reasons is because people want us to get through these applications of these tobacco products. And that's easier said than done. There's 26 million applications that we have received. 26 million. I'll say that we have gone through 99% of them, which is quite remarkable. A lot of folks like to focus on that 1%, but I remind them of how far we've come in terms of 99%. And at present, we have authorized 23 e-cigarettes in terms of marketing authorizations for those products. We do receive applications for other products as well. This is just the e-cigarette ones, the 26 million. And we've authorized 23. All of them are tobacco flavored, so none of them have any kid-friendly appeal. And then we've issued negative actions for millions of others. And so as part of our process, we have to, again, look at the science and look as if the benefits of those products for adults outweigh the risks, known risks for kids. And so it's a high scientific bar given the prominent use of use of these products. And so that's why we've only authorized a handful. And particularly since 80% of kids who are using these products are using flavors, it's a very high bar to get a flavored product authorized, because you have to demonstrate that that benefit would outweigh that risk. And so at present, we continue to go through these applications, but you may have asked yourself, well, what about those synthetic nicotine products that you just got authority over? That dumped another million on top of the stack. And that was shortly after I arrived. And so that was one of my first tasks. I took a nice week in between CDC and FDA. I went to Iceland. I went to London after to Wimbledon. It was fabulous. Then I came back. I ended up getting COVID, and I came back on a red eye. And then I was getting a call on Sunday morning, my first day on the job. Normally you think like, oh, it's just the pay period start day. You don't actually have to do work. Oh no, 8 a.m. on a Sunday. Welcome, welcome. And so one of the first challenges was, how many applications did we get? And everyone underestimated the amount of applications. We got another million. And the way that the law was written, they gave us 60 days. 60 days. And so I did the calculations on a napkin as I was convalescing, borderline comatose from the COVID, and 17,000 a day. 17,000 a day. If you work 24 hours a day, 7 days a week. So Herculean at best, impossible at worst. But a good lesson in the bureaucracy is, how do you handle this? And that's a key tenet. When everyone asks me, what is your greatest lesson? And it's like, the bureaucracy is always going to be there. I frequently joke that when the apocalypse comes, there's going to be three things. It's cockroaches, share, and the bureaucracy. And so you have to be able to navigate the system. And so as part of that, it's like, okay, I understand my task. I need to be able to get through these applications, but people need to understand that we got to do it right. And so we're going to get it done, but we have to reinforce through communication strategies and also let people know that we're committed to continuing to make progress over time. And so that's what we did. And I'm pleased to report that we are now over 99.5% done. So we're almost there. It's kind of like pruning a tree. Yes. Thank you. Thank you, Paul. Someone acknowledges. Yeah. I need to get you in charge of our social media account and start counting. So we're almost there, and it's almost like pruning a tree as well, where some of the initial ones are a lot easier. And once you get to the top of the tree, it's more difficult because there's going to be further review, and you kind of get into certain issues with the applications. And so we're making great progress on this as well. But again, science has to be the guide, because what we don't want is to move something forward prematurely that's not going to be scientifically and also legally defensible. So now let's shift to enforcement and compliance. And so once we review the application, if you get a negative order, we then have the authority to take compliance and enforcement action. Okay. And so there's a lot of things that we do to make sure we can monitor the landscape. And so we have people all over the country. We do inspections that we send people to. We can do online surveillance. We can do retailer surveillance where we send folks out. We also have people at all the major ports in the United States, and we have the authority to block product from coming into the United States and also seizing product that may be illegal. And so we have a dedicated team in our Office of Compliance and Enforcement, which also works with our Office of Regulatory Affairs at the FDA to make sure that we're monitoring. And so we can take a variety of actions that I'll talk about. But in terms of ensuring people are in compliance, we take a threefold approach. The first is training, education, and outreach. We want to assume honorable intent and make sure that the people that we regulate have the information they need. That's half the battle. You got to make sure people know what the expectation is. And so we educate. We have webinars, we have resources resources. We have guidances that we can issue to the public to make sure everyone knows the expectation about what is legally permitted to be sold. We also do surveillance inspections and investigations. And so again, as I said, we deploy people out. We have contracts with all the state health departments. We do routine inspections and we collect information. That can be on the sale of illegal products. That can be underage sales. It can be a lot of different things in our statute from the Tobacco Control Act that we can take action to make sure we're protecting public health. And then on balance, if we find things that are violative or illegal during those inspections, that's when we can take enforcement action. And we have broad authority on this front to make sure that we are enforcing the law. And so this is our toolbox on this visual. And we're going to start, there's kind of two major areas where we take action. One is the manufacturers. And so this is the people that are creating the product. We are responsible for manufacturing, marketing, and sale. And so we have authority over the manufacture of these products. And so there's a lot of things we can do. Typically, we start with a warning letter. So that's at the bottom left. And that's where we basically tell the people, listen, you got a problem. This is the issue at hand, and this is what you need to do to correct it. We typically give a set number of period for them to correct it, and they have to work with our lawyers and the Office of Compliance to take that corrective action. And so we give them the benefit of the doubt. After they get that warning, we then continue to inspect. And so we stay on top of folks. And if they do not take action, we then can escalate. And so recently, the FDA, within the past few months, has ramped up our escalation against manufacturers. In October, we issued the first injunctions against e-cigarette manufacturers. There were 6. And then also earlier this year, we issued the first civil money penalties against manufacturers as well, which is a fine that's posed on them for engaging in the sale of illegal products. This is a really important component of our toolbox because if people aren't afraid of potential action, they're going to continue to violate. And so the complexity of this matter is that FDA doesn't have independent litigation authority, which means that we can't take these people to court. We have to engage with the Department of Justice. And so that adds an added layer of complexity to make sure that we have the cases we need and that they're strong. And so I know when we took the first injunctions, I got a lot of flack publicly as you are enlisting the U.S. Department of Justice to take action against e-cigarette manufacturers. And my response to that is we're the federal government. Those are our lawyers. Who else am I going to call? The National Zoo? Of course, that's who's going to take this work on. But we've really positioned ourselves to note that we want to enforce against the law. We want to make sure that people are obeying the law. And we've got a lot of different options. And so we can also do recalls. We can do seizures of large volumes of products if we do an inspection somewhere and there's a large volume. We can also do criminal prosecution as well. This is the other side of the house. All these other things are civil, but we also have criminal prosecution as well that we can escalate depending on what happens. But again, a lot of tools in our toolbox. Same with retailers. So that was the manufacturers. Those are the people who make the product. Then it goes through distributors, which we also regulate, and then it goes into the retailers. And that's the places, the convenience store, the grocery store where you may buy the products. We have similar ability to take action here as well. We typically start with warning letters. We have issued over 120,000 warning letters to retailers since the inception of our center in 2009, and we continue to release many warning letters as well. You may think, oh, it's a piece of paper. Who cares? We see prominent compliance. The majority of people who receive a warning letter comply. A good example is late last year, we saw an uptick in nicotine gummies. And so it's basically a little gummy candy that includes nicotine in it, particularly through some initial surveillance in California. And so we did enforcement work and reconnaissance to make sure we were collecting information. We identified an online retailer. We issued a warning letter, and within 2 hours of issuance of that letter, the website was removed and the product was off the market. And so that's the level of very quick action that we need to monitor the environment, get the data we need, and to take action. But again, if they don't comply with the warning letter, we got other things in our toolbox, and we have to make sure we have evidence to help support it. But it's a key lever of our tobacco regulatory actions. So in terms of some examples of what we're doing, there's a lot of pretty egregious things that are happening out there, particularly around youth appeal. These are some examples. We took action in November against youth appealing products that were being sold. If you do a Google search, there was an expose of someone who did a purchase various e-cigarettes right around our campus at FDA to document the products that were being sold. We were already on these things. We do weekly surveillance of these different marketplace and continuing to issue warning letters and other actions. And so we, on this sting, made sure that we went after youth appealing products, including these e-cigarette products with cartoons and also toys similar to the Nintendo Game Boy here. I will say that there was a lot of folks as well that frequently criticize our actions against these products. And my response to that is, if you are an adult smoker using an e-cigarette to help you quit smoking, it's a very hard sell to me that you need Homer Simpson's face emblazoned across the front of that product to do so successfully. And so it ultimately comes down to making sure that we're using our authorities to enforce the law. It's a large Wild West in terms of the products out there, but we're focusing on those products with high youth appeal, high youth use of these products in terms of our compliance and enforcement strategy. Okay, so now let's switch to rulemaking. So we've done the enforcement compliance, we've done the applications. We can also implement rules. And so these are broader. We don't have to do a piecemeal approach. We can issue a policy that will broach the diversity of products that are out on the marketplace. And in self-respecting bureaucratic form, there is a process for it. And so whenever we want to issue a new rule or regulation, we have to first, we announce to the public that we intend to do it. And so we'll issue a press release, we'll let folks know, we just kind of stir the pot a little, get people all primed up, and then we issue the actual proposed rule. And so that's a very a long process in terms of developing the science, developing the evidence base to substantiate the rule. And then after we do that, we then put it out for public comment. And this is a really important aspect of the process because that's where we engage with you all and the public in terms of researchers and the scientists that are doing work in these areas, and also the public health community, the general public. We look at data from a variety of sources. We also look at lived experience, particularly for rules that impact certain populations that I'll talk about in a bit. And then after we get those public comments, we then synthesize them, and we have to read every single one of them. And I'll give you a little taste of volume on the next slide in terms of what we're dealing with. And then we issue a final rule. We take into account all of those comments and we decide, do we move forward with it? Or do we stop it? Do we make edits? Or do we don't release it at all? And so that's part of the continuum of the process. And so we've got three big things in our queue that may be of interest to you. The first is we have proposed a rule to prohibit menthol in cigarettes. This is a long-standing disparity issue. 8 in 10 Black smokers in this country smoke menthol cigarettes compared to 3 in 10 white smokers. So marked disparities. And sir, if you're taking a photo, the left side is my best. The right is not good. If you can go. And so this has profound public health implications, particularly around health equity. We know menthol use is markedly higher among Black Americans, also LGBTQIA+, and also those with lower socioeconomic status and behavioral health conditions. So talk about a profound public health impact and something we've been working on for years, and we are at the end of the tunnel, folks. We have already gotten support from the current administration, and it's in the unified agenda with President Biden, and we are gearing to get this out by the end of this year in terms of a final rule around menthol. We're also addressing flavored cigars. Remember, I talked about those flavored little cigars, cigarillos. We are proposing a rule as well to prohibit all flavors in cigars. And that, again, is on the same trajectory to get the final rule out. It's already gone through public comment. I might want to guess how many we got. 250,000 comments. And so we have finished reviewing all of those comments. We were required to respond to each one. And now we move on to that final our rule phase. And so we're currently there with both of these, and has been noted by the White House and others in the unified agenda that we intend to get these out by the end of this year. We also have another one in the queue to finish the trifecta. This is to cap the maximum level of nicotine in cigarettes and certain other combustible products. So we know, and frequently you've probably heard that people smoke because of the nicotine, but they die because of the tar. So it's not the nicotine that's causing the adverse effects, but it's certainly the highly addictive agent. And so if we could cap the level of nicotine in these products so that people don't get addicted in the first place, that's going to be a key lever, not only to prevent initiation, but also to help promote cessation. And so we have announced our intent to propose a rule to cap the level of nicotine in cigarettes and other combusted products to minimally or non-addictive levels. This would be a revolutionary product standard. This has been the glimmer in the eye for the tobacco control community for 30 years. We've talked about it as an endgame strategy that would help reduce combustibles, and it is before us, folks. And so we are working very diligently at the Center for Tobacco Products to get that proposed rule out. It's not as far along, so it hasn't gone to public comment yet. So the next benchmark is get that proposed rule out. Then we'll look at the science, and that could include, should we include other tobacco products as well? And what is the available science around that? And include other factors as well in terms of impact on different populations. But we've been researching this as a broader community for decades, and the randomized clinical trials and other science is showing very promising effects in terms of the benefit of this, and also lower levels of compensation. Some people think, well, you lower the nicotine content and then people will just smoke more. And the science actually shows that's the opposite, that you are able to get people to quit, and it's a very immediate effect as well. And so we'll certainly have an opportunity for public comment, but this is moving forward. And again, a profound population-based strategy that you implemented at the broader population level. You're going to inoculate the population with an intervention that will reduce the accessibility, acceptability, and access to products that are going to increase the likelihood of addiction. And that's what we do. You got to do that prevention lever and then make sure it's part of a comprehensive approach. So the final component of our work here is also the tobacco public education campaigns. And so this is a long winding trail and something that I'm very proud of in terms of our communication work at the Center for Tobacco Products. We've started in 2014 with the Real Cost campaign, which is focused on youth prevention. We have done the Fresh Empire, which is targeted towards African-American, Hispanic, and Asian American Pacific Islander youth. We've also done This Free Life, which is focused towards LGBTQIA+ young adults, and also continued to update the Real Cost campaign over the years. We're primarily focused on youth prevention, but have also done some cessation, the Every Try Counts campaign among adults. And this has been especially important to reinforce that most people who attempt to quit, it takes a few times. And that's not a bad thing. You learn something each time along, and then you'll get down there eventually. And, you know, again, nicotine is highly addictive. And so every try counts in terms of building that experience to get you to final cessation of the product. And so we continue this important work. This past summer, I'm very proud that we did Next Legends, which is a campaign focused towards American Indian Alaska Native youth. And this is really an important lever in terms of communications approach and making sure that we are reaching people, again, particularly those disparate populations, because that's where we're going to see the greatest momentum, where we're reaching populations in key ways. The content is relevant, the mechanism of delivery is relevant, and the message is going to resonate with that audience to affect public health change. So now let's transition over to making an effective sign. So I mentioned this a bit in terms of my press conference experience early on over at Roswell. And this is a really important component of our strategy. I was the Deputy Director for Research Translation for many years at CDC in the Office on Smoking Health. And part of that role was really taking the science and packaging it in a way that people can actually understand. And that's easier said than done. And as scientists, it's really important. You don't want what I call them scientific shelf pieces, where you get this technical treatise of information, which is important, right? You got to get it accepted to the journal, right? You got to pass those 3 reviewers, including that one problematic reviewer that you always have, and you wonder what planet that person emerged from. But it's ultimately good that you have that, but you also have to translate the science into practice. And that's where the communication is very important. And so in terms of our work, we leverage a lot of our campaigns to get people to resources. And so the Real Cost is a good example. We also evaluate it. That's really key. You need formative science to make sure your campaign is solid, but then you got to evaluate and make sure it's actually having the impact you want and that it continues to have that impact. You may need to zhuzh it to make improvements over time. And so the Real Cost campaign has had significant effect in terms of preventing initiation of kids who are smoking. We also have significant dollar savings as well. And this is important because you have to remember your stakeholders. And we'll talk a bit about this shortly, but different messages resonate with different people. And so you have to remember what the lever is that's going to be pushed. And frequently it's money. Money talks a lot better than the public health argument, which is unfortunate, but it's the reality of the situation. And so we're very mindful in our evaluations of making sure you're looking at the public health outcomes, but also the direct and indirect health costs as well. And by direct, I mean direct care in terms of the cost of treatment, but also indirect in terms of lost productivity. And lost productivity is very important. So remember, if someone dies from smoking attributable disease, they're no longer in society and they're no longer contributing. And so there are resource costs associated with that in terms of individuals who are leaving the denominator. And so when we do our evaluations, you want to be mindful of that broader approach for all our campaigns to really look at that broader savings of what we're getting in terms of immediate, but also long-term for public health and also for the econometrics measures. So here's just an example of the real cost. These are our latest ads. These ones I'm really proud of. We released these in January, and it was the first time we did campaigns focused on behavioral health and the issues of anxiety related to cigarette smoking. These are primarily digital campaigns. We do a lot of cognitive testing and formative work to make sure that we're really reaching the population that we want to. And so in this case, it's kids. And where are kids? They're definitely not at home dialing the rotary phone. And so you got to go into the key areas where they are. And so we certainly shift that focus. We're primarily in the prevention lane because that's where people are primarily using the products. 1 in 10 youth around e-cigarettes. And so we're justifiably concerned around the youth angle as well. I'm also mildly worried about youth and other ways. I was recently looking on the internet and there was a meme and it said that if we just started writing in cursive and started driving stick shifts, we could demobilize an entire population. And it really struck with me because I feel like that could very well occur. And so we have to continue to drive the public health message, but also be mindful that things change. And we have to make sure that we evolve with the times, particularly around our messages. Okay, so we also do print media as well. These are some good examples of some health equity work in terms of our sign. You got to reach people in different ways. We do have prominent science showing that there's certain populations that receive information in better ways, whether that be through electronic media like kids. We do know that some Asian communities receive information better through print resources. And then there's also some age variation as well, which is why things like quit lines are so important, but also with more newer text-based support. This was the Next Legends campaign focused on American Indian Alaska Native. And so this was, again, a focus of health equity that's important. We worked with tribes leading into it to make sure it was salient information and also worked with them closely on the distribution, which was important. Whenever you do these types of tailored campaigns, you have to work with key folks that know what they're talking about, including the population of focus to, again, make sure that it's going to be an impactful endeavor. So one area that comes up in comms as well around making the sign, our sign is continuum of risk. And so this is an issue in tobacco control that's gotten a lot of attention lately. I think it's divided the community in an unproductive way. And the notion is that, particularly around e-cigarettes, is transitioning adult smokers completely from conventional cigarettes down to e-cigarettes. I consider myself a moderate, and I think that it's not an either-or situation, that we can do everything we can to prevent youth initiation of products, but we also want to make sure that we continue to explore the opportunities for these products to transition adult smokers to lower risk alternatives. But it's got to be evidence-based and data-driven. And so that's why we look at the evidence. We know that as a general class, e-cigarettes are lower risk, but that doesn't mean they're no risk. And there's other factors, including around flavors, that we have to look at. And so our balance in terms of our signage is making sure that we're mindful of cutting the head off the beast in terms of the youth prevention issue, but also being mindful that these products could help adult smokers. And we've seen some greater innovation in this space with the introduction of nicotine salts, which is basically a different pH of the nicotine. And so they increase the pH and it allows higher levels of nicotine to go down a lot easier. And so this has been revolutionary for adult smokers because you can now get more nicotine easier in a way that could replace what you would have gotten from a regular cigarette. On balance, it's a problem for kids because it's also higher risk of dependency for nicotine naive populations. And so it's that double-edged sword and making sure that the products, again, are well regulated and you're not continuing to see increases in dependency, which is concerning to me because after these products with nicotine salts have come on the market, we're seeing increased frequency of use among kids. So among the kids who are continuing to use e-cigarettes, they're using them more frequently. And what is that an indicator on? Dependence. And it's because it's easier for them to get dependent on the product and to use it more. Okay, so now we're in the last two sections. We have to be mindful of the weather. And so there's three key factors in terms of being mindful of the weather and what comes down the pike. So the first is the diversification of the landscape. This is particularly important. As I noted earlier, we don't want to play public health whack-a-mole, where you allow certain products to go up, others to go down. When it comes to kids, we want to make sure we're addressing the diversity of the products. And that's important for a variety of reasons. One is research. You want to make sure your surveillance tools capture these products. You want to make sure the terminology is right. A good example is a lot of these tobacco products are known by their brand. And so if you include a survey tool that asks the youth if they use an electronic nicotine delivery system, like you're sure as hell not going to get a positive response. So you have to make sure you include the brand name, the terminology. And so there's a lot of cognitive testing and formative work that goes into that. And then on balance, you then use that to affect policy change. And so it's this broad continuum continuum of making sure that we're mindful of all the products. And then it's also important from a clinical standpoint as well to make sure that those who are treating tobacco use independence are aware of the different products that are out there and that they can help identify and screen for them at the clinical visit and also provide, importantly, appropriate interventions at that point. Now we get into kind of this stakeholder issue as well and the different players on the field. I will say that in terms of the Center for Tobacco Products, we have a variety of stakeholders. That includes industry, that includes public health, that includes the media and the general public, and there are definitely very shifting tides on these issues. And so it's very important for us to be mindful of who all the players are and what their contributions are to the discourse. And so the weather can change depending on whether people are supportive or non-supportive. And you're also always getting pummeled by someone. And that's why this is very much a thankless job, because you're always going to agitate someone on the end, whether it be public health, whether it be the industry. You also have the retail sector and also have people on Capitol Hill as well that are continuing to push. And then you also have a highly litigious atmosphere. So anything that the Center for Tobacco Products does, we typically get sued frequently within hours of taking the action. A good example is we just issued the recent marketing denial orders for menthol e-cigarette brand. And within a couple hours of us issuing that marketing denial order, we had a lawsuit on our desk that was many pages long in terms of the bringing it to the courts to take action. And so everything we do, we have to be mindful of legal risk. And mostly anything you do is you're going to have legal risk, but it's prioritizing what is the magnitude of that risk and what's the importance in terms of taking a public health action that's going to be particularly meaningful. And so that involves striking a balance when we're taking these actions. And so I will say that there's definitely alive and well criticism of the work we do. The Twitterati is quite prevalent. I've definitely received my fair share of threats, many from folks that I'm sure are enjoying it as armchair epidemiologists in the luxury of their mother's basement, which is very easy to criticize. But what's more complicated is making sure that we use the science and the law to implement a policy that is actually going to be effective and impact public health. And so that's my job in terms of making sure that we are taking that very careful balance in terms of the different strategies that are in front of us and being mindful of people that, you may not be able to please everyone, but you are implementing a strategy that's going to be defensible. And so part of this is also diplomacy and engaging with people. And I'll talk to anyone. I meet with our stakeholders. I meet with industry. My calendar is legally required to be public. So anyone I meet with shows up on that calendar. And that's important because I'm a federal official and it's important that we're transparent. But you have to collect the information and you have to strike a balance in terms of ensuring that you're sharing that information in a meaningful and productive way. And that's part of the work that I do. And so finally, let's close it out in terms of staying safe. And I frequently get asked, well, okay, you got all these scientific and legal risks, and, how do you kind of keep things steady and moving forward? And the biggest thing is science. Science plays a key role. And I'm the first scientist in this role. I'm the third person to occupy this role. The first was a clinician. The second was a lawyer. And now I am the lone scientist. So I'm sure there's a joke about the three of us walking into a bar somewhere. But I think I bring a very unique lens. And particularly given the science-based import of everything that we do, particularly around the applications, we have to be mindful of the science aspects of what we do and making sure that that's driving. We are a data-driven agency, and we also have an important purview around public health. A lot of times people ask me, are you a regulatory public health agency or a public health regulatory agency? And my answer is the latter. We are a public health regulatory agency that is part of the U.S. Department of Health and Human Services. And so data-driven public health is our key guide. It will continue to be our guide. And that's got to inform everything we do, from the application reviews to the product standards to the communication campaigns. It's got to be that underlying bellwether for all the important work that we do. And that's why stakeholder engagement is going to be so critical. I've talked about this previously, but it's really important that you engage folks across all ends of the continuum. You're not going to agree with everyone. And I think that's an important diplomatic skill set. And many of these things I learned actually here at UB in Roswell, where it's very easy to criticize, as I noted, but the bigger picture is making sure you hear people out and continue to follow that science in a meaningful way. I'll say that, I've got thick skin. I have worked under Mike Cummings, Tom Frieden, and Donald Trump. So nothing scares me. But you have to talk to people. And so I have worked very diligently across multiple administrations, including with multiple surgeon generals, to really find what are those key areas that we care passionately about, and then channel that energy in a really productive way. And it's also important to keep in mind that there's a lot of inbreeding, particularly across the US government. And so some person that you're working with now, you have to build the rapport. So down the road, if you're working with them again, that they're going to want to work with you, and that you may not agree on something, but you do have a shared collective goals that you can identify, and you can do it in a diplomatic and collegial way. And that's been my bread and butter for 13 years in the US government service, and it will continue to be. And that's why it's so important to everything we do is engaging people in a really meaningful way. So now let's wrap it up. If I put you to sleep, you can rise from your slumber. We are at the end. You can evacuate down the side if you want to get out before question and answer. These are the trip highlights. And so remember, pack your bag with the tools you need. Our tool is the Tobacco Control Act. Have that destination in mind to set your direction in terms of where you need to go. We have that clear public health purview. Use the map to know all the ways that you're able to reach your destination. So our product standards, our enforcement and compliance, our health communications, the different work that we do in terms of the application review. And you also have to kind of know where you are on that journey. And so you use the information from the data around the trends in use, around what are the types of policies that are happening at the state and local level, and really use that in a meaningful way to affect change. You also have to make an effective sign. I cannot reinforce this enough, the importance of communication, and it is transparent communication. You have to tell people what you're doing, when you're doing it, and how you're doing it. And the classic, when I came to the government, I call it black box communication. It's like the black box epidemiology, similar analogy, where we tell people in the start when we're going to do something, and then we wait till the very end when it's coming out to tell people when it's being released. And the problem is that you have a large black box in the middle where there's nothing happening or nothing being said. And so the interpretation is that you're doing nothing. And that you're not working on the issue. And so that vacuum gets filled with negative energy. And so the task for us, particularly as federal regulators, is making sure that we are transparent as possible across the continuum. And so towards that end, our center is taking many strides to ramp up our transparency and our communication around what we're doing to make sure we are reaching people and they understand opportunities for input on the work we do, but also messaging in a way that you can actually understand. And I know in the federal service, even now, I sit in meetings and there's a lot of really smart people. I consider myself reasonably intelligent, and I'll sit there after 5 minutes and say, I have no idea what you're talking about. It's so a technical treatise, and there's so much acronyms, it's just like an alphabet soup. And so we have to be mindful of how we communicate and that our signs are actually reaching people in a useful way. You have to be mindful of the weather. The weather is always going to be a problem. You're going to have diverse landscape. You're going to have a lot of different players. You're going to have litigation, but that is the nature of the beast, and you have to make sure that you weather it in a productive way. And then finally, you have to stay safe. And what strategy works? In public health, the science never fails. You have to do the best science and continue to evolve over time. I know in my time leading the science work for CDC's COVID-19 response and even the EVALI response before that, everyone's like, well, you're kind of flip-flopping and you're changing your recommendations over time. And my response to that is that's how science works. You use the best science that you have, and as you get more information, you then evolve with the recommendations. And so that's certainly what we do in the Center for Tobacco Products, but the data is always going to drive the decision-making that we do. So with that, I'm going to close. I know we've got a lot of students in the room, including some high school students as well, which is marvelous. I frequently get asked about jobs and opportunities at the federal government. And I will say that internships and fellowships are the greatest conduit to get into federal service. And so we have several of those. If you want to go to my center, we have fda.gov/tobacco products and a lot of great opportunities in terms of internships, but also outright jobs for those of you who may be coming out of the master's or the graduate PhD level. And we're always looking for new, bright, young talent. And there's opportunities for everyone. The staff of the Center for Tobacco Products runs from the gamut, from statisticians to toxicologists to environmental health scientists to communications specialists to lawyers, you name it. I think we even have some geologists on the staff. It's a remarkable array of folks that are doing really great work. And that's what makes us tick, is making sure we have that diverse insight to fully make informed scientific-driven decisions. So with that, I'm going to end. We're going to open it up for questions. These are the different avenues you can reach me. I will say that those of you who know me for many years, my old email at CDC, my middle initial is A, so it was baking@cdc.gov. So baking@cdc.gov. I used to get a lot of recipe recommendations. I'm going to write a book one day with all the recipes. I used to get questions about salmonella and cookie dough and whether they should eat it. So I don't get that fun anymore. And there's not an opportunity to reach me directly, but I guarantee you that if you do contact all of these resources, we will connect you. And we have a lot of great social media resources. We're on LinkedIn, we're on Insta, we're on YouTube, we're on Twitter, and we're on Facebook. We're not on Snapchat. I got a briefing on that, a little horrified on multiple fronts. We're not quite there, but we got a lot of opportunity and resources. And so I encourage you to follow us. And we definitely look forward to continued opportunities to really reinforce that we're not done on the tobacco front in this country. We've got a lot more work to do, and it's going to take collective input from a broad, diverse array of stakeholders to get us to that end game. So with that, I will close my mouthpiece, and we're going to open it up for Q&A.
Wow. Yeah, pretty good, Brian. Fantastic. Fantastic. Maybe I'll open. I see a hand here, but open. If you had, there's many students, you had indicated one piece of advice, one thing that, kind of sticks out, for when they grow up and get big. And of course, Brian's recruiting, but nobody that works here would ever want to go to the federal government or anything like that. But if there's something like that, and then we'll get in the back here.
Yeah, sure. So I guess my tidbit of advice, and I get to ask a lot, is like, don't change who you are. Like, I'm a character. I know I'm a character. I've always been a character. And that's what parts of make you tick. And so don't change for anyone. And it's really important that you find something where you're going to fit and you're going to be passionate about. And it may be difficult, but my advice is always find something that you're passionate about and follow it. It may not be easy. People are going to throw bricks at you, but you got to build the foundation with the bricks that people hurl at you and use that to get to your end goal in terms of achieving, something that you're passionate about. So I can't reinforce enough. It's okay to fail. It's okay to dabble in things. That's good. That's how you learn what you like. But ultimately, make sure you've got a passion and that you follow it in a meaningful way. And towards that end, if there's any way I can help with folks, I pride myself on being a Zennial. I'm the combination of right between the Gen X and the millennials. And so I communicate. I know how to use a rotary phone. I was in college before the internet, but I'm also very mindful of where we're going in terms of the landscape evolving, and that we have to communicate in a way that reaches all populations. And so I can't stress enough the importance of the need for new young talent to continue to inoculate in not only the federal service, but public health more generally. So that would be my tidbit of advice.
Well said. Well said. I think we had a question here first, and you could speak slowly and clearly so people can hear. And I think, speaking to the microphone, I think people online.
Great, thank you. Nice to see you again, Dr. Kim. I really enjoy your talk, very informative, especially for folks who, like us, who want to translate our research to real, public health impact. My question is about the warning messages for e-cigarettes. We know right now the warning message is about nicotine. So whether it contain nicotine, if so, we say nicotine is addictive chemical. But for the cigarettes, combustible cigarettes, we have a lot of more other, warning labels such as like health impact, like lung cancer, COPD, heart disease, and reproductive health. So can you give us a sense about, FDA's kind of guidelines and or plan in terms of warning labels for e-cigarettes in the future? What kind of evidence that you guys are looking for? Thanks.
Yeah, sure. So I'm happy to broach the question. I will say that graphic warning labels or pictorial warning labels, as we refer to them, are certainly an evidence-based approach. And so we've seen those implemented on cigarette packs internationally in many countries, and they have large visuals that typically occupy a proportion of the front of the pack. And so if you travel internationally, even to Canada, you'll see them. And we know that these are effective at preventing initiation, but also reducing consumption and helping promote cessation. In the United States, we have now tried twice to get those graphic warning labels onto our cigarette packs. At present, we do have warning labels on other tobacco products that primarily focuses on nicotine. But in order to change the labels on the products, we have to do a new rule. And so that goes to that process where we have to first announce it, we have to propose it, we have to take the public comment, and then we have to finalize that. So we tried to do that over a decade ago. We got sued in federal court and we lost on First Amendment grounds. We were asked to go back and try again. And so we did that. We went through the whole process, developed new pictures as well, and developed the science, conducted the available studies, and then we went at another go. We did a final rule, we released it, we got sued, and we lost again. In terms of the concerns is primarily First Amendment, and it occurred in the Fifth Circuit, which is in Texas. And so recently, late last year, we finally got a decision out of the judge in Texas who sat on the decision for 2 years and finally gave us a negative order. And we are currently in the process of determining what our next action will be in terms of whether we are going to appeal that. The Center for Tobacco Products has noted publicly that we would like to appeal that decision. If so, it would likely go to the Supreme Court for an ultimate decision. And so at present, that's where we're at in terms of our second round of the cigarette warning labels. And if we were to do something similar for other products, it would require, again, that rulemaking in terms of going through the science. Right now, the science is strongest around cigarettes, and so that's where we're focusing our energy. But it's a good example of the legal complexities, that anything we do, we will get litigated against, and there's also a possibility that we will lose. And so in countries where you're not dealing with the same parameters, such as First Amendment requirements, it may be easier to get that policy implemented. But in the United States, there's key standards that have to be met according to the Constitution, which has been well received by certain judges in various circuits. But ultimately, we continue to follow the science. We believe the science is strong, and we're hopeful that we'll be able to get this latest round of ads through and ultimately out into the public.
Mm-hmm. Awesome. I think we're over here in front.
So we have a remote guest here who asks, in evaluating e-cigs, how does the FDA figure in long-term effects of these products, since the long-term effects are currently unknown, given their relatively short time on the market? Why shouldn't e-cigs be only allowed through a medicinal product like the patch or gum?
Mm-hmm. Okay, so in terms of the regulation of these types of products go through 2 channels in the United States. And again, it's not anything I created, it came from Congress. And so we tried to regulate them as medicinal devices, and we lost in court. We lost in the Supreme Court. And so we were told that you have to market these products as tobacco products through the Center for Tobacco Products, unless they are marketed with a therapeutic claim. And so if there's someone who wants to promote their e-cigarette as a cessation device, they have to submit that evidence through my sister center, which is the Center for Drug Evaluation and Research. And remember, that's the safe and effective standard. And so it's very different from the appropriate for public health standard. And so at present, we have not had any e-cigarette that has been authorized through the safe and effective standard through CEDAR. And all the products on the market are effectively tobacco products then, which is under my jurisdiction within my center. Again, we are required by Congress to look at certain things. And so as part of the application review, we have a discipline of about 15 different areas where we look at the evidence around those applications. And that can include everything from epidemiology to adverse events, to toxicology, to chemistry, to environmental health. And we have specialists that look at every single one of these areas, and they provide then a recommendation to the technical project lead, which coordinates for that specific application, and then makes a universal decision based on all the products. I will say that we certainly consider the health effects as part of that determination. We include a variety of other things as well, as I noted, and ultimately it's what is the net benefit or gain. And at present, we have authorized 23 e-cigarettes. And the reason those were authorized is because that benefit among adults outweighed the risk to kids. And it's primarily because those products did not have a risk around flavored. And so right now there's been all tobacco flavored e-cigarettes, which we know is lower appeal to kids than things like fruit and cherry and candy. But there's also other things we look at in terms of adverse event risks and other factors. And so the long-term health effects are certainly something that continues to evolve, but we do have sufficiently robust evidence at present to know that e-cigarettes as a general product class are safer than a conventional cigarette. On balance, most things are. At 7,000 chemicals and 70 carcinogens, that's a pretty tough standard to surpass. But if an adult smoker were to transition completely, there would be a net benefit, but it doesn't mean that they're safe. there's still inherent health risks, but we have to look at that continuum and the risk benefit across all the products. And that's what we do. And that's what's led to the authorization of those 23 products that have received the authorization to date.
And that may be the answer to this question, but have any e-cigarette manufacturers submitted an application to the CDER?
I cannot confirm or deny that. I learned long ago never to speak for anyone else in the federal government. So not my first time to this rodeo, but I cannot. But I will say that there was actually news media today, and this is already out in the public. My predecessor actually has signed on to assist with a startup of a product that they intend to submit. And so there's certainly some interest on that front, particularly around the cessation front. But in terms of what's been submitted, we're actually prohibited from saying that since it's confidential company information. But I can certainly say that there's people that have publicly postured on this, including even more recently within the past day that they've announced their intent to do that.
Fantastic. These are great succinct questions. Lots of hands in here. I see one here and then in front, and then we'll work on the back.
Well, Doctor, thank you very much for the services you've been providing for all of us for all these years. I'm the chief public health official in Niagara County. And in my county, I have many populations, but I have multiple indigenous population tobacco retailers. And when I look at, $10, $12 for a pack of cigarettes versus $3 or $4 for a pack of cigarettes, I have a lot of underage and people throughout my county who go there for those low-cost cigarettes. I'm not allowed to go on there and do any work on tobacco control, but being from the federal government, is there anything that the federal government can do? There's no doubt that we have a big part of our population going to these tobacco retailers, smoking more cigarettes because they can afford them. There's talks from the state about adding on additional taxes, but that doesn't help when those taxes don't go to the the indigenous population retailers. So is there anything that FDA has done or can do with that?
Yeah, so I'll certainly say that we respect tribal sovereignty. And so in terms of the actions that FDA takes, we do not regulate traditional or sacred tobacco, but we do regulate commercial tobacco. And so that includes products that are manufactured by various entities that are selling commercial products. And so as part of our portfolio, we do regulate these products. We are able to do inspections. We are able to enforce the parameters of the Tobacco Control Act. And so we do that for a variety of products. It includes e-cigarettes. It also includes conventional cigarettes as well as cigars. And so we are able to take action in a variety of those retail and as well as manufacturer buckets that I noted in terms of enforcement and compliance. But I do think that there's also an important comms opportunity here as well to engage with key stakeholders. And it's very apparent that there's marked disparities in terms of use of tobacco, commercial tobacco among American Indian and Alaska Native populations. And so that's part of the driver from some of the work we're doing, including around the Next Legends campaign, was really educate about the risks and also reinforce around how detrimental these commercial products are to key populations. And so for our part, we're doing the comm strategy, engaging folks, and we also are doing enforcement and compliance. I will say that there's a lot of tobacco retailers out there, and there's also a lot of variation in terms of untaxed and lower tax sources across the country. And so ultimately, it's very ideal that local and state implement salient strategies that are going to be most effective in their context. And for our part, we'll continue to have that broader umbrella, but it's got to take that comprehensive approach of local, state, and federal action if we're going to address it in a meaningful public health way.
Right, and tax policies outside of your
correct.
purview,
we don't do
state and
smoke-free.
local.
We don't do tax.
Challenging issue, but the opportunities are there. Tony, and then I see a bunch of hands back here, so we'll.
Yeah, quickly, Brian, just from the previous comments about e-cigarettes, it looks like that they're never going to be falling into the zone of other NRT, that there'll be commercial tobacco products right alongside combustible tobacco. And you sort of noted that maybe a new frontier is regulating the amount of nicotine. Is e-cigarettes on the bill for that same deal, that you regulate the amount of nicotine in combustibles and also in e-cigarettes?
Yeah, so like in response to the first, I will say that I wouldn't negate the possibility that there could be an e-cigarette that's approved for cessation. I think that we're now to the point where there's more innovation, and I think the innovation of nicotine salts has been particularly important in that context, because you now have the ability to deliver enough nicotine that would replace what an adult smoker got from a conventional cigarette. And the current e-cigarettes that have been on the market, if you looked at the early RCTs, you weren't seeing the cessation, and it's because you weren't replacing what they were getting from a conventional cigarette. But with the new innovation in terms of the products entering the market and the ability to deliver that nicotine, I suspect that we will see better results in terms of the randomized clinical trials around the efficacy of the newer products. But ultimately, you got to have that evidence if you're going to implement any type of approval or authorization. On the e-cigarette front, I'll say again that we follow the science. And so right now there is robust science around conventional cigarettes and certain other combustibles. We've got randomized clinical trials over many decades that have demonstrated the net effect in terms of diminished compensation of smoking more, and also various other factors in terms of cessation. That said, we haven't removed off the table the possibility to include other products, and that will be part of that public comment. And so the onus will really be on the broader scientific community, where we're moving forward with where we currently have the science. But if there's more information from scientists, from the research community, from the public health community, and you provide that during the public comment, we take that into account in terms of the final rule. And so that's why the process is so important, to make sure that we get the information, but ultimately we have to base the decision on the science we have. And right now, in terms of nicotine caps, the science, the trials, the observational studies are on conventional cigarettes, not other products.
Super. And who's in, like, who, I saw a few hands. Who's furthest in the back? Maybe we'll start from there.
Now in the cheap seats,
Try to get
yes.
people. Who, yeah, who, yep, hands up so we can, and Brian, we're gonna extend this Q&A until your secrets are revealed.
Yeah, this is a
Get
bit cruel and
the
unusual.
bright
How
light up
is
here
this?
and.
What did I do to you?
What do you think of New Zealand's recent decision to the policy of changing the age of sale year over year? How do you think that's going to play out? And I hesitate to ask this, but could we ever do it in the United States? What are the barriers to that?
Yeah. So I think it's a really good end game strategy. And so as part of the tobacco control community for years, we've been talking about end game, and it refers to kind of those, like at one time pie in the sky. Nicotine cap was one of them. And so the Surgeon General's reports dating back to about 2014 have highlighted that as a potential option in terms of really making a profound impact in reducing combustible use. That said, I think that it makes sense scientifically. The only issue of being a visionary vanguard is that you're the first person out of the gate. And so it'll be very interesting to see what happens in New Zealand. I think that there's good, sound, formative science, and then the evaluation will be very key if they want to get that done. In terms of the United States, I just reiterate that we have a very different regulatory process. And as I noted, we have to implement the rule and the product standard. We have to get the feedback before we finalize, and we're almost always met with litigation. And so in order to diminish the likelihood that folks will win, we have to be very strong in terms of the science and evidence that we have. And so it's important that we have that evidence. I think that, evidence can come from a variety of ways. That can come from other countries. It can come from the local level. It can come from the state level. We've done that with the current menthol rule in terms of looking at the evidence from Canada that's already done this, from the state and locals that have done actions to prohibit flavored. And so ultimately, I think it's a good thing that we're starting to see the inoculation of some of these policies in other areas. And it certainly could be something that could be considered in the long run. But ultimately, in our context, we got to base it on the science and the evidence. And if it's not there, it's difficult. We have made strides on increasing age of sale. Tobacco 21 is a good example. That was something that percolated from the bottom up. The first was in Needham, Massachusetts in the early 90s. And then we started seeing states started to implement these from 2016 onward, including Hawaii was one of the initials. And now we got a federal law that was able to be implemented, and a bipartisan one, which was very important. Mm-hmm. And so you had Mitch McConnell and Senator Tim Kaine sign on. And so those are interesting bedfellows. But if you have that political support to get a law through, that's another avenue where things like this can happen outside of regulatory structure. But ultimately, something like that, I would anticipate would require a strong evidence base and wouldn't necessarily be something you can go through the legislative route.
Super.
Linda Duffy, former Department of Health and Human Services. Hi, Brian.
Hello, how are you?
Very good. Thank you for that. Illuminating talk. It was like listening to Saturday Night Live. I loved it.
I try, I'll be here all week.
So, you really gave a really ground level, true, I think, picture of what it's like in federal government. I was at NIH in the Office of the Secretary, but I think this is it. And you're doing a marvelous job. My question is more at the ceiling level of policy change, because I heard you allude to it multiple times in this talk. My experience working with Peter Marks, your counterpart at CBER.
Oh, I adore Peter. Yeah, I will. I just saw him this week.
And I'm still collaborating with them on a number of public-private partnership initiatives, which is where I personally believe it's all going. We can't do it alone in government, and we certainly can't do it in any way as consumer only. I found it was most effective when the Federal Trade Commission and FDA on multiple issues with Peter would come together with the Office of Science and Technology Policy. I'm sure Pauline saw this in government when she was there. When those stakeholders come together, when we're together and we're working toward policy change beyond the final rules, and I realize how much that takes to get a final rule through, and worked on multiple final rules with Peter. But beyond that, to really have a policy change, you have to have a valuation, right? And in that valuation, the United States coming to terms with OSTP, that's where the change happens. How optimistic are you that you, in your new role, are going to be that transformative influence? Because I believe you can be, but I'd love to hear from your point of view. Where do you think it's going?
Yeah, absolutely. So I agree with you completely. I think the interdisciplinary approach is the way to go. And my take on all of these is leverage the opportunity in a way that can set you up better off than where you started. And so my approach has always been, if we've got something before us, let's use it in a way that we can strategize and maybe change the way things work. And so as part of, I'm not a lawyer, which I think is a good thing coming into FDA, because the lawyers are all over the place. It's just infesting all over it. But it's good as a non-lawyer to kind of say, why are we doing this and who could we potentially bring to the table to inform the work? And so I think a good example is with the menthol product standard, where we had an opportunity before us. There was strong support, but we were also mindful that we needed cross-sector support on this, including around cessation and also social justice issue. And so one thing that we decided to do was to coordinate across the U.S. Department of Health and Human Services. And so we got a champion at the top in the Office of the Assistant Secretary for Health to coordinate activities across all of the operating divisions within HHS. And so that includes FDA, who's doing the rule. It includes CDC, who is doing promotion and comms. It includes NCI, that is doing smokefree.gov, includes CMS, VA, and really taking exactly what you're saying is that engagement. And we chose to do that before. So, 6 months before, to really get things percolating. But you're absolutely right that all the way through, we have to continue, including an evaluation, scientific component, and really engaging with folks. And so I will say that definitely well engaged on OSTP. I was actually at the White House 2 weeks ago, meeting with folks, and couldn't agree with you more in terms of the importance of making sure that we use this as an opportunity for interdisciplinary engagement, but also changing the status quo. And we frequently have a very siloed view of federal service and the work we do. And I think we've got a great opportunity to, one, enhance the robustness of the science, make sure we're engaging with new people, particularly new stakeholders that maybe we haven't in the past, being mindful of how we communicate and looking for new ways to reach those people in a useful way. And importantly, the health equity lens. I cannot reinforce that enough in terms of the comms and the engagement on that front. So I'll say I'm hopeful. I'll say I'm 25 years away from retirement, so we're stuck with me for a while. And I'll do everything I can as a zennial to help inoculate the populace into a productive outcome.
Khadija asks, how would you ensure transparency with communication to the public aside from flyers, signs, and other labeling?
Yeah, so I think that this is multifaceted. And for folks who aren't aware, my center got an external evaluation that was called by the commissioner, which I wholly welcomed. It happened shortly after my arrival, and we brought in the Reagan-Udall Foundation to evaluate. And they came out with 15 recommendations for our center. And one of the key underlying themes of that was transparency and communication. And I think that we've got a great opportunity to really reevaluate what we communicate and when. There's certainly some things that we cannot say, and that's just the nature of the beast. We're dealing with market moving information and confidential company information. And so there's certainly things we can't communicate it on. But I'm wholly committed to making sure that we, and don't get me wrong, we're not going to go to Fort Knox to a national park overnight, but somewhere in between in terms of us being mindful. And so I think it's a multifaceted approach. It's traditional media in terms of comms and making sure that we're doing press releases. We're making sure we're advocate strongly when we do have releases on various issues. We also have to have our continuing longstanding communication around health risks. So that's our comms campaigns, the prevention work around real cost and others. It's a multifaceted approach where we address it through not only print, but also digital and also social media engagement. Again, you got to get to people in the places they are. And then the last component of that is really stakeholder engagement and communication. And frequently, especially in my position, there's a lot of concern around, oh, you can't meet with that entity. And I'm the complete opposite. I will meet with anyone. I have not turned down a meeting since I started. You got to wait a while. Sometimes it's 5 months if you want to meet. And they book me in the 15-minute increments. But it's very important, I think, to build relationships and to also communicate at the individual level, particularly with stakeholders. So you have that opportunity to engage in a way that could proactively stave off issues down the road if they don't necessarily understand your position or you haven't identified some mutually agreeable ground that could prevent them, from coming out with a press release criticizing you or implementing some types of strategy to counter your message if you don't really understand where you're coming from. And so for me, I see comms as a very broad, but also critically necessary component of every aspect of the work that our center does.
Absolutely. And then who else was there some, yeah, here? And then we've got one in the back. And then one here and one here. So there's 4. I think we have 11 minutes left. So
is that a
keep it
knock at me,
punchy.
Andy? Do I have to be less
How transparent are you going to be and make
Okay,
them
Mine
short?
You have cocktails.
Really quick. So
Okay.
you were talking about millions of applications coming in. I just wondered how many people are reviewing each application, and I assume every application is going through everybody's hands. So how many people are viewing these applications?
Yeah, so our center has about 1,100 to 1,200 staff. We are 6 offices, including my office, the Office of the Center Director, and our largest office is the Office of Science, which is about 550 people. I will say that the vast majority of that office is involved with application reviews at some point. I will say that some of these applications are very long, if not hundreds of thousands of pages. And so we have about, I would say, over a dozen different disciplines that review all the content. And we've certainly looked at opportunities to streamline that approach, but we have to be mindful that we review the full scope of science. So it ultimately comes down to making sure that we're able to get through the volume, but also in a scientifically defensible way. So we have hundreds of people that are working on this, but that doesn't mean that we may not benefit from further resources. And so one key factor that we're currently advocating very strongly on in terms of educating people is this issue of user fees. And so my center is funded by user fees. We are not funded by taxpayer dollars. The user fees are from the industry we regulate. And so the major market shareholders in the tobacco industry are required to pay fees every year, and that's what funds our center's budget, which is about $750 million per year. And a sizable portion of that goes to application review and enforcement and compliance. And so right now, we do not collect user fees for e-cigarettes. And so we're expending about 90% of our enforcement and compliance activities on a product for which we are not collecting 1 iota of a dollar. And so right now we are educating folks on that issue. The commissioner in our latest budget, he was just on the Hill earlier this week and noted the $100 million increase that we're looking for our budget in terms of bringing user fees and scope for e-cigarettes so that we are able to take that comprehensive approach. And with more dollars, a bulk of that would be dedicated related to application reviews. So we've got a dedicated team working day in, day out, burning the midnight oil, but it's an unprecedented landscape of applications. And as I noted, even with the synthetic nicotine products, we got dumped in 1 million, and the expectation around 60 days, it would have been 17,000 a day, which Herculean at best, impossible at worst.
Super. Who, I think in the back, and then there was one in the middle, Katie, and then Paula.
Thank you. I especially liked hearing about the upcoming news related to the menthol and the flavors. That was very heartening to hear and news to me for sure. My question centers around a little bit more context for me, as I guess you could say is naive to tobacco control. Like, I don't think there's too many people who are going to try to make the argument that, you know, tobacco and nicotine are good for us and extend our lives and make us better. So I'm curious about just your explicit take on, I guess, the folks that are litigating coming in. I mean, are these people who are like, my constituents want to have the right to smoke because they've been addicted for 30 years. We benefit from tax revenue. Like, what are these parties who are sort of at odds with your mission around best thing for the public health?
Yeah, so I will say that the primary litigants, it depends on the issue. For smoke-free for many years, it was more advocacy-driven groups, also industry to some extent. But the primary folks that sue the FDA Center for Tobacco Products are manufacturers. It's industry, and it's because we are, regulating their products. And if there are actions taken that could mitigate their ability to secure income, they're going to sue. And so if we issue a negative decision on their product, that means it has to come off the market. And so they have a vested interest financially to make sure those products stay on the market. And so frequently the first action they'll take is a stay in the courts, which effectively allows their product to stay on the market while the litigation is determined. And so it's primarily industry. I will say, though, that there's also been an evolution in terms of the marketplace, and the typical tobacco industry has started exploring lower risk alternatives. And so there's finally this, I don't know if I want to call it a cathartic realization by some, that cigarettes are bad and combustibles are bad. And so we've finally gotten to that point where I think every reasonable human being can agree on that. But now industry has shifted their paradigm, and they're now saying, well, we acknowledge that it's bad, and we want to transition people to lower risk alternatives. And so the portfolio of the industry has now shifted to smokeless products, heated tobacco products, and also e-cigarettes as well, at least domestically. I will say that a lot of the industry continued to promote combustible products internationally, and so there's certainly a cash flow there. But in terms of the complexity, industry is evolving, and they're primarily going to lower risk alternatives, which still faces litigation if we issue a marketing denial order for them.
And we'll go to Paula from Roswell, and then Katie, you'll close us out for UB. We'll give the UB to close.
I won't be long thank you so much for your leadership. It feels so good to have you at the helm, and specifically with the menthol and the cigar flavored stuff that we've all been waiting years and years for. So kudos to you and your team. My question is regarding that. So as you push that through, and as we realize menthols are coming off the market and there's going to be this increase in cessation need, is there any conversations at the federal level about providing more funding or support for direct cessation services to the states?
Yeah, so definitely good question. And so I think that we've got a great opportunity around cessation. As I noted, we do have an interdisciplinary work across HHS working on this. Admiral Ortega up at HHS is leading the work across HHS, and it's focused squarely on cessation. And as part of that work, we are planning a White House summit this summer to convene key experts on the issue. And I would hope that a discussion would be opportunities, including making sure we're maximizing our ability to help people quit once the product standards are released. So I would encourage folks to capitalize on this opportunity at the state, local, and national level to really look at, we've got a lot of people that are going to want to quit once we implement the policy. And we got a good foundation. We got a lot of resources, but are there areas where we need more resources? And let's find the mechanisms. And I know that my colleagues at CDC are definitely thinking about this. They run the National Tobacco Control Program and also do cessation funding. And there's also some non-government organizations as well. For FDA's part, since we're funded by user fees, the work that we expend can only be on the strict regulation of tobacco products. And so there's limitations on what we can do for cessation. We're certainly certainly happy to be at the table, but it's really those other government partners that are going to play a critical role. But in addition to the state and local, which is so critically important, including the New York State Smokers Quit line, where I got my start. Yeah, Paula used to be my boss way back in the day. I used to answer the phones. Yes, at the Quit line over downtown, and I hope it's not in the same building anymore. It was giving me asbestos vibes, that old building, but we've come a long way. Okay, I think yes.
And then one more.
Thank you very much for that transparent communication of your center's important work. So I'll take it back from the ceiling level to the ground floor, thinking about our next generation that we are training, we're inspiring. Do you have any recommendations for engaging students, particularly undergrad students that aren't really doing research yet, in meaningful anti-tobacco, anti-vaping advocacy?
Yeah. So I can't reinforce enough the importance of that really locally salient and relevant advocacy. And so we've got a strong foundation for this for tobacco across the country. We've even got representatives I know in the room and online for a lot of these community-based advocacy organizations. And it's absolutely essential. And it's been the bread and butter of tobacco control for decades. And that's how they've been so successful. And people are using the tobacco control playbook. You've got alcohol, you've got nutrition, you've got others. And the reason they're using it is because it worked. And it's that grassroots advocacy and engagement, and the youth component has been critical for decades. Whether you're talking about conventional cigarettes back before the Master Settlement Agreement in '98, and now it's just turn the page, new chapter, same book when we're talking about emerging products, including e-cigarettes. And so in terms of advice for engagement, I think the local level coalitions are a really key conduit for youth. I think school-based work is incredibly important as well. We're starting to see a lot of engagement at the school level with organizations, and every piece counts in terms of the work that's being done on this front to really help with prevention. It's very easy for a federal bureaucrat to come in and just pontificate and run my mouthpiece, but we really need people that are key gatekeepers and that can relate to the key populations, and that's where youth come in. And that's why we're so important with the ads we do at FDA. It's the youth-focused ones have those youth messaging and component and inclusion. And as part of that, we also have advocacy outreach strategies as well. And so I'd strongly encourage folks to get engaged at the local coalition level, get engaged at the school level. And there's also national orgs as well. The Campaign for Tobacco-Free Kids has great opportunities as well. And then also Truth Initiative is another a national org that does a lot of local-based work. And they have strong youth arms that do critical advocacy. And so if there's any interest, reach out to them. They can connect you to national groups, but also at your local level if you want to start an organization or continue to tap into an existing coalition effort at your local level. So we need more of it, and I hope that we continue the passion, because again, the job is not done. And we don't want to be playing this game of public health whack-a-mole. We need to train the next generation. And part of that is getting people passionate and mad as hell at the onset. And so that then when they age up, we're fully prepared to combat things in a meaningful and productive way for public health.
Thank you so much. Let's give Dr. King a hand.
Thank you.
And now we have a couple of tokens for you.
Thank you.
To commemorate your really amazing lecture. Thank you so much.
Oh, wonderful. Oh, yeah. And it's below the $15 federal gift limit, I am sure. Oh, I love it. Look, it's the ad. Yes. Thank you. With my mug on it and everything. I love it. Thank you. That's wonderful.
And we also have a bag of some lovely swag for you from the university and the school and the department. So
wonderful.
Thank you so much.
Thank you so much. It was a pleasure to be here, and I hope you enjoyed the talk. Thanks.
Your apple.
Thanks.
Sure.